Hello, everybody. Welcome back to the Empowered Podcast. As per usual, I am just so happy that you're here. And I'm feeling a little giddy today because I have a new guest who is new to me and new to you. And I'm really excited to share her with you. And just before I get her to introduce herself, I want to tell you how I came across her. So I was scrolling TikTok one evening. If you do not yet have TikTok, well, beware because it's an app where it's really, really addictive because you get to see really fast videos that people have created. They're just like, 30 seconds or 60 seconds. And they're so engaging and they make you laugh or they teach you something and it's really fun. But sometimes like an hour and a half goes by and you don't even realize where your time went. That happened to me last night, actually. So anyways, I was scrolling on TikTok and I came across this beautiful video of this amazing woman that was sharing, hey, do you want to learn how to feel your own chi? And I've actually had that experience before, but it was years ago. And I thought, oh, who's this girl? What's she all about? And I started watching and I went through everything that you had shared and I could feel my energy. I could feel my chi. And then from there, of course, I clicked on her profile and then I watched her other videos and I clicked on her Instagram and then I did all the things. And I sent her a message and said, can you come be a part of the Empowered Podcast? And that is how we have Corinna here with us today. Welcome. I'm so happy that you're here. Please say hello to everybody that's watching and listening.
Oh, hello, everybody. I'm so excited to be here. Thank you for that really wonderful, warm welcome. My name's Corinna. I am a licensed acupuncturist. No, it's okay.
So funny. I thought that before our episode. I thought, man, I should probably check if it's Corinna or Corinna.
And I didn't say it to correct you. I just, in my introduction, I'm Corinna. I'm a licensed acupuncturist in the state of California. And I have a master's degree in traditional Chinese medicine, and I am a big advocate for young adult cancer awareness and a second-generation Chinese American and very proud member of the LGBTQ community.
You are amazing. I'm already just having such a great time getting to know you. We took a few minutes before actually starting to record this to share a few things about ourselves. And can you tell us about your puppy?
Oh, yes, I can tell you about my puppy. His name is Walter. I wish he was here that I could show him to you right now. He is a pug Chihuahua mix. He's got very long legs and a little smushy face, and he's 5 years old, and I love him very much.
That's so special. Those of you who have been listening to this podcast for a while know, or if you follow me on Instagram, you know how obsessed I am with my dog Dixie. So that was a really nice way for us to have a beautiful connection together. So how long you been doing this? How long you been healing others through your work?
Oh, well, it's actually been a really long road because prior to doing Chinese medicine, being an acupuncturist, I did Reiki healing, and I have been treating people for the past 3 years with acupuncture. But prior to that, I was doing a lot of different work in Reiki. But it's kind of like a long and windy road that got me to where I am now. And that's a much longer story if you're interested in hearing that.
I mean, I am actually. I would love to hear. Yeah, tell us.
If I'm thinking about how I got to where I am now as an acupuncturist treating patients, I always go back down the path of what I call my illness story. And that is really intertwined with my cancer diagnosis. I also have cancer, which is also intertwined with my coming out story. So it's kind of really long and complicated. So cut me off if I keep talking.
No, I want it all. Let's go.
So I guess if I'm going back through that path, when I was graduating from my undergrad, I did my undergrad at UCLA in my senior year. That's kind of when I was coming to terms with my sexuality. I guess I'll just jump right in. And I was kind of just beginning the process of coming out. I started coming out to a few close friends and to my sisters, and I had met my very first girlfriend, and in true lesbian stereotype fashion, decided that we were going to move in after just knowing each other for a few months. But this whole process of coming out kind of brought up a lot of internalized shame that I'd had growing up about being queer, about being Asian, about being a little bit different. So all of that kind of started to surface, and I started noticing all these different changes in my body. Like this extreme fatigue when I was walking to class that I thought was normal, but I didn't understand how everyone with backpacks didn't want to fall over and collapse once they got to class, just from walking. And then I would look in the mirror and I had noticed that I had this black eye under my left eye. And nothing had happened. I didn't know what it was, but eventually all these things would like come and go, and I kind of pushed it away. And I would wake up in the middle of the night with this like pit in my stomach, with my body just telling me that something was really wrong, and I would ignore it because I had so much going on. I was just graduating. I was going to start adult life. I had a job lined up and really excited.
I'm busy.
I'm busy. I didn't want to deal with it. I couldn't be sick, but my body was telling me something was really wrong. So I did go to doctors to try and figure things out, but I really didn't fit the bill of someone that was sick. My lab work all looked normal. I was young, otherwise healthy. And they were like, we don't know what it is. Maybe take an antibiotic, see what that is. Maybe you're just having some sort of flare up of something. Not sure. And of course, I'm like, great. Yeah, that's what I want to hear. Nothing's wrong with me.
Yeah.
I'm just living my life. So I took that to heart, and I was like, I'll just continue on. But right after graduation, I started working. So I had like graduation ceremony Saturday, and then Friday, and then Monday after that was my very first full day of work, and just started working. And I was trying really hard to impress them. But in the process of doing that, I was starting a whole new life and talking to my parents about my new job, but couldn't tell them anything about my new relationship. They were pretty traditional. I knew that being gay wasn't really an option. It wouldn't be well received. So keeping that secret, was kind of weighing really heavily on me. And I noticed that I was starting to get more bruises on my legs that I didn't know where they came from. And sometimes they would come up and go away. But now that I was working every day and lying to my parents, the bruises would come up and they wouldn't go away, and they would just get bigger. So eventually this just kept spiraling, and I wound up in the hospital. I saw a doctor that was like, this is not normal. There is something wrong. And once I was in the hospital, my parents came to visit, as parents do. They were very
when you're early 20s. Yeah.
early 20s. I wound up in the hospital, and I was there for about half a month. Them trying to figure out what was wrong with me, doing all these tests. They had no idea. So I'm in there, and my parents are visiting me, and my girlfriend that I'm living with, that's a secret, is also there. And I am terrified of this like culmination of events of my secret just kind of being exposed. And like the nurses who were there, who had been talking to me since I'd been in the hospital, are just like, maybe just tell your parents. And I had kind of in my mind conflated this idea that my illness, my sickness, was because I was gay.
Oh.
It's a really common conversation between anyone that has any chronic illness and is queer. But I thought that, like, okay, the burden of the secret, this is what the nurses are talking to me about. The burden of the secret is too much. I'll just tell my mom. And maybe there was like a slight hope that if I told her, like magically I would be better. And also there was this thing in me that knew, like, I'm like here in a hospital bed connected to all these machines. My mom is there. She cannot get mad at me if I tell her.
This is a safe place.
Safe place. But it's also, my poor mother, she's like worried about her daughter and like can't take much more else. But I told her, but it didn't relieve, I wasn't magically cured. I'll put that up there. But it was the first step into coming into who I was and being honest and living in my truth. And she wasn't mad at that moment. She was like, please just focus on getting better. Further on down the road, it was more of a process with my parents. I love them and respect them. But it did take some work. But in that moment, she was like, I want you to get better.
Mm-hmm.
But right after I'd come out, actually, doctors came in and told me they had done a biopsy of the tumor site and found out that it was a T-cell lymphoma. And immediately after that, did a bone marrow biopsy. And I don't know how much you know about that, but to do a bone marrow biopsy, they give you a lot of painkillers. But they don't really work because the pain is deeper. So I had been given some morphine and Ativan. So I was told I had cancer. I had just come out to my mom, and then I was really high, the highest I'd ever been.
Oh my God.
So I was there and I had this really unique opportunity to just kind of like observe all of these feelings and this huge shift that my life had taken in the past like hour, and recognize that like nothing in my body was so different, but like now I just had names for all these things and all these secrets were out, and I was just there floating. And like eventually I came down from that high after the bone marrow biopsy and, you know, dealt with life as is. But it was like a weird window into a moment which felt like, okay, I can process this without feeling all of this fear and trauma and shame that had just been clouding my thoughts for the past like lifetime.
Mm.
Um, and I had to take a year off of work for treatments, but eventually went back to work and tried to get back to normal. But all the while, when I was at work, I was, you know, going through a bunch of different treatments, and I was still getting these bruises on my legs that would come and go. And with that, I knew that there was something that needed to change about the way that I was living my life, because when I was at work, it didn't feel the same as it was prior to that when I was excited about it.
Mm.
Because now health had become a bigger priority to me.
Well, and I would assume that would start to shift your perspective also of just what does bring you joy and what is important to you, because going through something like that, especially at such a young age, you look at things differently, you question things differently.
Yeah, absolutely. Where my priorities were when I first started working prior to my diagnosis was, okay, I'm going to do the adult thing correctly. I'm going to climb this social corporate ladder. I'm going to make money. I'm going to be financially independent. That's what it's going to be.
Then
But
I'll
then
be happy. That's the goal. Then I will be happy.
and I'll delay that because my current space of not being that happy, it's just because I'm working towards happiness.
Yeah.
And that shifted when I was in cancer, when I had cancer and I knew that I had cancer and I was working with cancer. I was like, I don't know how much time I'm going to have. You face your own mortality every day when you're a person that's sick, and it's so unique when you're young, because no one else around you is really doing that, unless you have a lot of young friends that have suffered from chronic illness or have some life-threatening illness, which wasn't my experience. So I kind of felt like I was navigating all that alone, of course, with some of the support from my family, but working with that kind of priority and having none of my coworkers and colleagues reflect that made me feel very isolated. Um, and so while I was working, I ended up getting acupuncture for the first time. And it's a little bit like cultural background. I'm Chinese, so I've always kind of been open to the idea. And when I got acupuncture done, I'd walked out feeling like amazingly lifted from my ears. And this is something later on I would find like the idea of like decision making and courage and strength all reside in this in the gallbladder organs channel, and the gallbladder kind of runs around these ears. So um, I had come out of my acupuncture appointment, gone to a meeting at work, and I remember feeling like my tumors in my abdomen just pulsating while I'm talking about like a Levi's color palette. And I'm just saying like, oh gosh, this is not important to me anymore, and I can't continue the rest of my life this way. And I put in my notice, I told my creative director, and they were really supportive, and I went on a year of disability. And that's kind of when like the whole world of complementary medicine really opened up to me, and my like deeper healing started to begin.
Wow. Wow. That is an incredible, amazing story. And you might not be done, but it's like that kind of your story wraps in, I feel like, everything that I have been observing and witnessing and learning about life, and where as humanity we kind of went wrong for a while, at least in our Western culture. And you have experienced this firsthand at such a young age. And like, do you feel that what you do now and where you're at now is where you're meant to be?
100%. I do feel like it's where I am meant to be. And there's this thing that we talk about in the Neijing, and the Huangdi Neijing is like kind of like the root text of all Chinese medicine. It's where all the other texts about Chinese medicine were derived. And in one of these texts, they really talk about the idea of like flow and ease. Um, and I study with a doctor, and he has a school. It's called the Xinling Institute. And we talk about the idea that when things are flowing with ease, you'll feel that things come more easily, and that you'll know that you are expressing your purpose. We compare humans to plants, and like the way that they describe it is the purpose of living is to bloom, and that's it. Whatever it is, whatever seed you are, you'll bloom and then revert back. And when things are going well, you'll open up to
Mm.
paths that are laid out in front of you. And that's
Mm.
like for me right now.
That's such a beautiful analogy, and I love that it connects so deeply into nature. And what I also hear in that, for those of you listening and watching and have been observing the way that, because I speak about this, but from a different angle, but the exact same thing, which is feeling really beautiful and parallel right now, but that a lot of human beings, I believe, have this system or belief within their mind that in order to bloom, I need to work hard to get there, or I need to like figure out my pathway to make that happen. And it's very much of that that pushing mentality, and that the masculine energy of making it happen. But what I'm hearing from you is, when you're in that sense of flow, when you're in that sense of ease, it occurs. It isn't something that you have to make happen. It is who you are. It is your purpose. It is your ability to bloom. And then also reverting back and going back down, but like even like a flower, when the sun goes down, it closes, and the sun comes out, it opens. This is natural.
And that's exactly parallel to the idea of yin yang philosophy, which a lot of people are pretty familiar with. Yin being the feminine and the dark, and yang being like a bright sun. So yin, the moon, yang, the sun. So the idea that within it, we all have these activities in our life that we have to pull from both and have
Yes.
them meld to move through.
Mm-hmm. Oh, this is, I like you. So what would you say for those that you work with, the clients that you're working with, what are most of the things that they're coming to you with in terms of their ailments? Or what is it that they're saying? What are their ailments? What are they coming to you with?
Well, so prior to COVID, I had done some work in an integrative center in a hospital for people that were diagnosed with cancer. And it wasn't necessarily like a young adult cancer population, but it was people that were recovering from cancer treatments. So to be clear, acupuncture and Chinese medicine does not cure cancer. It doesn't do that. But it's something that is pretty widely accepted within the Western medicine community to help treat the side effects of chemotherapy and the side effects of treatments. So when I was there, it was a majority of people that were kind of coming out of cancer treatments. They were older, but in my personal practice in Pasadena, most of the people that I'm treating are coming with a lot of anxiety, emotional trauma, trying to navigate how that is manifested in their bodies and what they can do to kind of express that and let it move through them so that they can kind of live with that ease that we were talking about. So I definitely deal with a lot of more like historical trauma, personal trauma.
And would you say that when they come to you, do they have those words, or is that you expressing what you see and feel from them in your words, or do they have that awareness within themselves?
Some do, because I think it does take a certain mindset to come to an acupuncturist where you have actually kind of like maybe considered the way that our experiences manifest quite literally and quite physically within the tissues of your body. Like the experiences don't just exist in our minds. That's a pretty like Western way of thinking about it. So some of them do, most of them don't.
Yeah. Yeah. When you shared that, I thought, man, that's impressive if they're coming to you with that knowledge of where things are manifesting and how they want to express themselves and what that looks and feels like. Which, I mean, for those that do, incredible. And for those that don't, incredible. You are still seeking out support for you in order to allow that ease and flow to come.
Mm-hmm.
I really feel this desire to grab something to show you. So I'm just going to take one moment. Okay.
Okay.
This is probably very silly, but I want to share with you this book that I have.
The new Chinese medicine handbook.
What's an innovative guide to integrating Eastern wisdom with Western practice for modern healing. Isn't that cool?
Amazing. I haven't seen that one.
This I don't even remember where I was. I think I was traveling somewhere, and this was sitting on the shelf at the bookstore, and I was like, I can't not buy this. I don't even know why. I've always been fascinated by Chinese medicine. However, I know so little about it. But the parts that I have some awareness of, I find fascinating in the meridians of energy and how everything is connected. And I love the philosophy that, even as you shared before, that I think it was like the courage and the I am concept of who you are, it
Mhm.
kind of resides within the gallbladder, which then also reaches up into the meridian around the ears, and how these are so interconnected. Because I just find that in the Western philosophy, everything is so broken up. And in my life, and I won't go deep into it because most of you listening have heard it, but the pains that I've had in my body have always stemmed from emotional trauma, and no one in my life could explain that to me. No one could help me understand that. It was just, here's some antibiotics, here's some pills, do this, instead of let's
Mhm.
get to the root of it, let's get to the base of it. And it, for me, it was always because I didn't feel safe to be who I was. I didn't, even like in your story, I don't have that same story of coming out, but I understand a small fraction of not trusting that it's safe to be you.
Mhm. Mhm. Absolutely. And all of those experiences that you have growing up um, aren't things that just happen and then kind of like, here we are. In Chinese medicine, we really talk about how every emotion, so there's this tendency to kind of somaticize specific emotions. So sadness and grief kind of exist within the lungs. So we'll see maybe clinically someone that has just experienced the death of a loved one, and they're grieving over time to develop kind of like a chronic cough, or maybe later develop asthma. So we'll know that, grief kind of overtaxes that organ when the emotions have ridden for too long. And that's not to say that all emotions are going to hurt your body, because they're so important. And and I'm sure all of your listeners know that it's important to have them and experience them. But when we talk about them being pathological in a Chinese medicine perspective, it's when we have them and then we don't move them. Chinese medicine is all about flow. It's all about creating ease of movement and space to breathe. And our tissues breathe, our cells breathe, everything in our body has this expansion and contraction movement. And when they're held in, and what can happen is emotions that are blocks, that are traumas, that are patterns that are just held and stiff, can impair this breath motion of our body. And that kind of makes it more difficult for us to just live the way that we want to live. But it's pretty interesting to think about how all of these emotions, at least in Chinese medicine perspective, exist in like this part of our body, not just here.
Yeah, absolutely. And it's so fascinating to me as well that our brain has so much capacity to have a thought, then trigger an emotion that can then have an impact on our body. That's how we are so interconnected. And the amount of women that come to me that I work with that are resistant to believing that they are worthy of love, or that they are worthy of having an hour of someone sitting and asking them questions and listening to them, or that they are worthy of spending some money on what brings them joy, or even exploring what brings them joy, or that they don't have to give every single ounce of everything that they have to everybody else, that they can actually reserve some of that energy for themselves. It's fascinating to me now, having been in this field for so long, that we are making progress, and I still believe we have so far to go. I'm
Uh, oh, you're breaking up just a
oh
little. Okay, I think you're back now.
well, I just want to share that your description, the way that you're describing Chinese medicine and energy flow, without me doing a lot of studying of Chinese medicine, I can see the parallels of my philosophies in my own mind of how things work, and how it is very parallel with just the way that you're describing now of chi and movement and energy flow, and how important that is. And I'm loving this because I feel like it's bringing a bit more of a structural background to what I can feel in my body and what I believe to be true. So I'm really grateful for this, for me personally. Thank you.
And that's super common with a lot of the people that come into the clinic. I think a lot of people that are drawn to this medicine are drawn to it because it resonates so well. And that's personally what brought me to the medicine, besides it having huge effects on my body, helping me recover from a lot of treatments. It was that it resonated with me because I knew deep inside me that all of these experiences, my life experiences, were completely intertwined and connected with the environment that I exist in and the people that I surround myself in with. And no one in Western medicine was kind of having that conversation with me about my external environment and my relationship to the universe. Like,
Yeah.
really,
Yeah.
all of in Chinese medicine, the human body is a microcosm of the macro. So just like the sun rises and the moon rises, we have those tiny little events in our body too. So when I heard that, I knew that I had seasons in my body, just like the world had seasons, and I needed to just understand it more. And I wanted to learn that medicine because that's it. There is a system in place that we can all follow, and we only really need to go outside and feel and reconnect with nature to know what that system is.
Yeah, 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 you speak my language. There's a yoga teacher that I've trained with. His name is Ian Finn, and
Uh-huh.
one of his core foundational values within his entire company and all of his teachings is connecting to the breath of nature and connecting to the rhythm of nature. And he's a surfer, so he's really versed with the ocean.
Yes.
And even in a meditation, creating the visualization of, this is what he shares, of a jellyfish and floating up and floating down and visualizing your breath up and down, or kelp just floating in the ocean, and noticing that that is our natural rhythm, and the speed with which we live life is causing us to feel out of balance, is causing us to feel fearful or worried or doubt or disconnected. And that's causing different emotions that could be causing more challenges in our body.
That's amazing. And that example of the jellyfish that opens and closes is one of the visualizations that we are given within aging medicine
Ah,
to like understand how the body breathes. So I love that there is that kind of connection there.
that is so cool. We have so many parallels in our lives together and in the teachings that we are bringing in. I knew I liked you from the beginning. So I'm curious, would you be willing to guide us through, so that original TikTok that I saw you on about being able to feel your energy, would you be willing to guide us through even just a minute or so of that you had done before?
Sure. I would love to guide you through that. Just a caveat about that. So
Yeah.
with TikTok, I had to do it. I mean, there's like a 60-second limit on on how you do that video, but I'm guiding through a whole bunch of different exercises in order to feel the chi, and that helps to sensitize the palm so that you can feel it. But eventually, what we're really trying to do is get better at turning off the switch of busyness and focus on what it has been and is always around us so that we can sense it. So eventually you won't need all of these exercises to do it. It does help and makes it easier, but soon you can just do this and then feel it on your own. But I'm happy to guide you. Don't
Yeah,
make it all.
I love that. I think I'm really glad that you shared that, because that is the longer game, the longer goal within it. And I'm also certified as a Reiki practitioner, and so that's one of the things that I love in activating the Reiki energy and being able to feel energy between my hands is just, to
Mhm.
me, it feels like I'm so much more than just Deanna.
Uh-huh. Uh-huh.
Yeah. So let's do this.
So what you're gonna do is curl your palm, curl your hand, and right where your ring finger lands is where you're going to find Lao Gong, which is a pericardium point. And you're just gonna massage, and you can do it on both hands. I'm massaging in small circles with a little bit of pressure, and this is just gonna open up the meridians right here. And then we're going to do it on the other hand. So find the same point. And if you have a tender spot in your hand, the meridian locations aren't so exact by measurements as they are like tender spots in your body. So you would be more perceptive and understand where these spots are more than just like using a ruler. So don't get too in your head about finding it. And then we're going to tap our pinkies together just like this. So there's a lot of meridians that run through this side. The small intestine channel comes from our pinky all the way up our arms. we're opening this up. There's 3 yin meridians that run down this soft part of our arm and 3 yang that run along the outside of our arm. So now we're going to turn our hands and do the opposite side, so the base of our thumbs. So we're getting the meridian on this side too. And what you should be feeling at this point is like a little bit of tingling and vibration kind of around out into your fingertips. And then what you can do, hard to do when you're sitting down, and a lot of people told me they couldn't clap behind their back, so we're just going to clap in front. So you just clap your hands. And it's fun. So they should start to sting a little bit, but in a good way. And then once they get all tingly, you're going to rub your hands together, build up a little heat, making sure to build up a lot of heat in the center of the palm. Once it's all hot, just gently taking a deep breath. Exhale. Pull your hands apart and glide your hands back and forth. And it really should feel like polar opposites, like you're holding 2 magnets. And the more that you do this, the further away your palms can be, where you can still feel this kind of magnetic energy and this force. And you can take that and put it in your lower dantian. I like to place it about an inch below my navel, but you can do anything you want with that because that chi is yours.
That is so beautiful. Thank you. And everyone who's listening and watching, hopefully if you're listening, you were able to guide through that. But I think both of us would love to know, can feel it. How incredible is that you can feel your own energy, and that, like you said, that's your chi, that's your energy, that is your life force energy, that is the flow that is within you at all times, and you just took a moment to feel it, but it's always there, it's always flowing, it's always a part of you. And I love that you also shared about placing that somewhere in your body. And so intuitively, oftentimes I will instruct someone, especially in a yoga class, when they're taking deep breaths, to place their hands anywhere on their body that I say needs some love, that needs a little bit of healing or attention or awareness or whatever it might be. And so in my mind, I envision the energy from the palms of the hand pouring into that place of the body. And I love that you just shared that as well.
I love that. And I love that you're also doing a lot of visualization with it too, because I think that's such an important part of working through movement of chi, because like it's not something we can see with our eyes, so there has to be kind of an internal visualization that happens, and that visual language is different for everybody.
Yeah. And I think even just through this conversation, the visualizations of the jellyfish and the visualization of the flower or of plants opening and then closing, all of this again is parallel with what we are doing, whether or not we can see it. And even some women that I've seen who teach and support with women finding their flow within their menstrual cycle, that's also very much about noticing the flow and the pattern within your body, and not trying to work against it, instead working with it and noticing that flow and that season is occurring constantly. And that is a gift. That is not something that we need to squash and squander and make jokes about how we need to eat chocolate and yell at our partner.
Yeah, it's such a blessing to have this once a month event that feels very tied to, the moon. And I also think that a lot of the complaints or like the difficulty that people feel with their menstrual cycle specifically is just the idea that like we have these cycles, but we're living in a system that kind of suppresses that cycle, not letting it happen. Just like you were saying, you just have to enjoy it and let it happen. But a lot of what we're told is like, no, you always have to work 9 to 5 every day like this, regardless of what is occurring in your body. So if we were to listen to our body and really feel those rhythms and change our lifestyle week by week based off of what our hormones are doing, based off of what the yin and the yang are balanced at that time, like what would that look like?
Yeah. Yeah. And I'm sure for some individuals, even that thought is a bit overwhelming because it's so different than what life is right now, but that's okay. I think that it's these conversations that start opening us up to seeing that things could be slightly different. And I loved that in the beginning, you and I both shared that we have this vision of one day having this beautiful, intimate retreat space where, it's our space where we live. It's connected to nature. It allows individuals to come and be a part of that rhythm. And eventually, hoping that those retreat centers almost don't need to be there because we can all find our way into our rhythm. And when I consider just a very short story of mine, I've worked in many different jobs, and I was good at them. I have a marketing degree. I am very creative. I was a great event planner. I worked in lots of different jobs that I did good at. but I was always sick. I picked up every cold possible. I constantly was feeling unwell. And I'm very sensitive in that I don't want to push myself when I'm not feeling well. I want to honor how my body's feeling and allow myself to not be there. But it got to the point where some of the organizations I worked for were like, "Are you okay? You keep getting sick and you keep staying home because you're sick." Well, since I started working from home, since I started following my heart's passion and infusing my life with these types of conversations and these practices, I don't get sick anymore. Like I might a little bit, but there's so much space and love for me to just process through that, and then it's gone. It's like a whole different reality. It is a whole different reality for me, and I love it.
That's so amazing. And like, I bet there are so many people out there that would have similar realizations, or that have had similar realizations, that like the environment that they're put in really is reflected in the way that their body is communicating to them. That's a huge thing that I'm sure that you work with your clients too, is just like, first step is, how do you reconnect listening to your body? How do you speak the language of your body? You grew up with it and it's been talking to you this whole time. So let's just listen to it and see what's going on.
Absolutely. And one of the big things that comes up a lot too, because I work primarily with women, is with body image issues and feeling insignificant because of having too much weight or not looking a certain way, or things are sagging, or there's too many wrinkles, or now I'm getting these veins. And even just what you just said, you've been in relationship with your body since you were born, like this should be your best relationship, really. Like this should be the one that we're pouring all of our energy into, all of our time into, all of our love, all of our taking it on dates, like spending long, luxurious evenings just being with our body and speaking the language of our body, because it's our ally. It's our buddy.
It is just kind of reaffirming that the relationship with our body is not one that needs to be fought, and it's not a bad one. I can't tell you how many times I work with patients doing abdominal massage, and especially with women, we are so conditioned to be ashamed of our stomachs, any type of anything on there, if we're not rail thin. So 100% every woman that comes into the clinic and I do abdominal massage, I teach them how to do abdominal massage on themselves. Them just in the act of touching their own stomach, just sitting there, yeah, so many emotions come out. We carry so much shame here. We're constantly sucking in. We're constantly holding everything in this center. And this is such an important area in Chinese medicine. There's so many things that go through. If we're blocking the flow here, things are going to become dysfunctional. But just having women get into their body and just accept the way, the shape, the feeling that it is, brings up a whole event of emotions oftentimes.
Yeah, that's so true. I remember going through a phase with my partner when we were fairly new together, where we would cuddle in bed, and I would get him to place his hand on my stomach when I was on my side when it was soft, and I would ask him to hold it and just to love it. And it didn't faze him whether it was soft or not. He didn't care at all, but I did. And I needed to be held in that discomfort that I felt in myself to come to a place of love.
That's amazing. And how long after that, like, did you have to continually do that, and then now it doesn't come back anymore? Is that something like you re-up every few months?
Yeah, I mean, I think we probably did that like specifically for probably like a year or so of just on and off of him holding me that way. And now he still will randomly, but we actually don't cuddle in bed as much anymore. But but I still struggle with body image. It's so deeply ingrained in my mind, but I'm able to touch my body and love my body 100,000 times more than I ever was able to before. And that is so much joy.
That's so beautiful. I see that super reflected within your Instagram.
Yeah, thank you. Yeah. And also, I mean, there's on Instagram, I share a lot of images of my body and of the way I speak to it, because it varies. Sometimes I'm frustrated and I want it to change. And the other times I'm in love and I think I am this beautiful goddess. And so honoring that we are all and that we are together shifting that narrative.
That's so great. Yeah. Having an idea that like it's body neutral. We are sometimes positive and sometimes we're not, and we'll go back and forth between the two.
Yeah. Do you, especially during this time with the global pandemic that is occurring, are you working with clients virtually or just in person?
Well, since acupuncture is I am a healthcare provider, it is considered an essential business. But so it's open, and I'm still open, but I see patients very limited because I, as a person with cancer still dealing with treatments, am super, super cautious about making sure that I am not spreading COVID, but that also people feel safe in my clinic and that I feel safe in my clinic.
Yes.
So I seeing people very limited. So what I do is I treat like 3 people a day, but I leave about an hour and a half in between each patient for the room to air out. It's a beautiful little bungalow in Pasadena, so I can like open all the windows,
Mm.
air filter, I wipe everything down. So I do treat, I am doing telemedicine occasionally too. Which is new for me. Prior to that, it was all about this like physical connection, but I'm actually really excited to be able to kind of start communicating with people that are in Canada or other parts of the US.
Yeah, well, that's one thing I'm wondering is for a lot of viewers and listeners, a lot of them are here in this general area that I'm in, and I'm wondering how they can engage with you and either learn more from you or work with you, and what that might look like, and also asking for myself.
If you come to see me and you can't physically come to see me, that's okay. There's actually a lot that we can do. Chinese medicine is a whole umbrella of types of treatments. It's not just acupuncture needles. There are modalities that I can teach you about, like moxibustion that you can do on yourself, but also Chinese nutrition is a really important aspect of the medicine, and Qigong exercises that we do. So what I normally do is like, I'll have a conversation kind of like we're having, I interrogate a lot of different things about your background, history, life. I ask you so many questions about how often you poop and what your most traumatic experience was. Okay. And then from that, depending on what level of comfort you have, I kind of craft a lifestyle document about what I think might help you moving forward. And that's for you to use sparingly, like you can dive all in or you can just kind of ease your way into it. And if it feels appropriate, I will recommend a Chinese herbal formula that can be shipped to you. If you're in the United States, I haven't quite figured out what outside of the US is, but that's what can be done from far away. But if you're in California, in Southern California, you can see me in person.
Amazing. Oh, this is so good. Okay, perfect. So what I will do is make sure that in the show notes that there is access to communicate with you. And this has been amazing. I didn't actually even bring up the whole theme of this month's of podcast is resiliency. I feel like we spoke about it without using the word. And even you sharing about coming back to neutral, and even the conversation with your body and speaking that language, to me, that all is in alignment. But is there anything else that you want to share around the concept of resiliency?
I mean, I definitely think we have spoken to it in different words, but when I think about resiliency in my own life, it always means not necessarily the strength to like just keep getting knocked down and coming back up, but the strength to always come back to presence and always having the strength to be in this moment and engage and the strength to be able to kind of like quiet things that I know aren't serving me. So as long as I'm having this ability, regardless of whatever is occurring in my body is going to do what it's going to do, and I'm going to take care of it as best I can. But if I have the strength to separate my spirit, and what in Chinese medicine we call the shen, my life's purpose, and that from everything else in the world, and know that this source is something that I can cherish, and that's what I'm going to focus on, and these moments are what I'm going to focus on. That's what resilience is for me, being able to always come back to that.
I'm in love with that definition and description. Thank you. That's perfect. And I think that's a really beautiful place for us just to bring this to a close. Thank you for everything that you shared. Thank you for telling us your story. And thank you for being who you are. I just met you, and I have so much love for you and your vision for yourself, and for helping others heal, and for healing your body, and for being present in your love and your connection and your life. And thank you.
Oh, thank you so much for that. This was such a wonderful and authentic conversation. I know I don't do this very often, so it just felt so good to do. I really appreciate you having me on here.
Oh, absolutely. It's my pleasure. And everyone listening and watching, thank you for tuning in. And I would love to hear, either send myself a message or send Corinna a message, and let us know what you take away from this. We're so excited to hear from you. Thank you, everyone. We will see you soon.